The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My name is Eva Shea, and my guest on today's episode is Dr. Joe Shvidler. He's a facial plastic surgeon in Seattle, and I'm really happy to have him here and hear his story today. Welcome, Dr. Joe.
Thank you.
So first, why don't we start with something really challenging? Tell us more about your specialty and what kinds of procedures you focus on every day.
So I'm a board certified facial plastic surgeon, and my interests are reconstruction of the facial and nasal structures, particularly rhinoplasty, nasal surgery, aging face, and any other facial cosmetic surgery on the eyelids, ears, cheeks, and neck area.
Now, you work in the same office as Dr. Bill Portuese, which is in downtown Seattle, but do you also travel around Western Washington a little bit?
Yeah, so we have a regional practice. We have a presence in Portland, Oregon, and I actually practiced in Tacoma, Washington for many years, and I've been practicing in Seattle now for about 6 months.
And anything in between Portland and Tacoma? You're supposed to say there's nothing in between Portland and Tacoma.
There's Centralia. There's nothing in between there.
I'm sort of playing with you because my husband is from PL, Washington, which is 30 miles west of Centralia.
Oh, okay.
And nobody's there except his family.
Yeah, we see folks from Idaho and Montana. They'll come up to Seattle sometimes too. So we there's pretty much Northwest, I would say.
Mm-hmm.
So we see quite a large geographic area.
So how did you end up in facial plastic surgery? Tell us what that journey looked like.
Yeah, so I've been fortunate enough to go to a medical school where I had some great mentors, and I was interested in surgery early on. I'm a visual learner, so I really liked anatomy. That really drew me to surgical specialties. I have an artistic background as well. I've studied art and painted a little bit, and not professionally, but just as a student of the art, and that's, I think, how I learn as well. So those things really drew me to surgical specialties, and I had a mentor in medical school who was an ear, nose, and throat doctor who got me really interested in ENT, and I think that had the most challenging anatomy. So I was like, yeah, cool, I'm going to learn the most difficult anatomy in a human body. So got really interested in that, and then as I went into my residency, we have different subspecializations or fields within ENT, and facial plastic surgery was really, really interesting to me, and see how you can improve someone's form and function, and the aesthetics was really kind of integral part of that as well. And I think with the artistic background, it kind of came naturally to me, so that's how I was drawn to that.
So do you ever help people who've had their nose hurt or their face hurt in an accident?
I have, yeah. And that's part of what we do. Is a lot of the surgery that we perform is functional in nature after injuries, facial trauma, accidents, injuries from sports, or injuries from previous surgery as well.
I understand that you were actually in the military for a while. What did you do?
Yeah, so I was really fortunate to serve in the U.S. Army for 13 years. I got a scholarship to go to medical school, so the U.S. Army sort of sponsored my education, which I'm really grateful for, and it was the best experience that I ever had in terms of training. So after finishing medical school, I entered a residency in the U.S. Army and was trained by some of the best surgeons in the country who are now practicing in some of the most recognized institutions around the United States, and got a great education there. And I was trained around the time of when the two wars that we were in were just kind of ramping up. So fortunately, there was a lot of funding for education. So I went to a lot of courses and had an opportunity to really get a lot of experience in both reconstructive and some cosmetic surgery as well in the military. And then I went on to do a fellowship in facial, cosmetic, and reconstructive surgery here at University of Washington, and then returned back to the military and served the rest of my time here in Fort Lewis.
Beautiful Tacoma, Washington.
Beautiful Tacoma, Washington, yeah.
When you're in the military, do you see different kinds of cases than you do now? Like, are there things that are unique to being in the military or about what kinds of cases come your way?
There are obviously, we took over a lot of veterans in the military, and we took care of some active duty soldiers who've had some pretty horrendous injuries, whether it was in the war or in training, etc. And so that really set the foundation for my surgical training, and I had an opportunity also to train generations of residents. And I taught in a residency program. We had many, many wonderful surgeons that graduated from our program that I still meet at the meetings and talk to them. So it's kind of a little family there. So that's kind of a nice community of doctors that we still have, and we still talk to each other and stuff. So it was a very special time.
Did you get to travel while you were doing that to other places, or did they just leave you stuck there in
Because I was a teaching faculty, fortunately, I was sort of chained to one location, so I did not get to go overseas, unfortunately. But many of my colleagues did. So, but I'm grateful for all the experiences that I've had in the military.
So you decided at some point you were going to move on. What made you decide it was time to go away from the military?
My family were the big deciding factor in that. So in the military, you kind of move around a lot. That's just comes with the job, and every 3 to 5 years, you have to go to a new location. And when the kids were getting a little older, we're kind of getting settled in, and my wife had a pretty nice gig here, so we just decided we really liked Northwest, and we made it home. She's from Arizona, and I'm from Chicago, and Chicago is too cold for her. Arizona is too hot for me, so this was like a perfect middle ground. So we just decided to stay here, and I finished my commitment in the military and decided to transition to civilian practice. And so I joined a large multi-specialty group in Tacoma, Washington, and that's where I practiced for 8 years after being in the military.
And then what led you actually to Seattle facial plastic surgery?
Well, my dream has always been to be in a private practice, and I think that's where you have your best ability to give the best outcomes to the patients and things that they're looking for, and have control of the things that you can do. And unfortunately, in current environment, it's really hard to balance the needs of the patients with the regulatory environment and things like that. So that makes it really hard and challenging in a large hospital system. And so I think to have the freedom of doing things that you like and what you can deliver to the patients, I felt that I needed to make that leap and join a private practice.
It's sometimes really fun when you cross from one world to another. The small things even that stand out. Does anything come to mind when you think about like when you made the transition from one side to the other? What were the small things that gave you great joy in that transition?
Well, I think of the freedom of my own schedule, the flexibility and being able to have more control over what I do in the schedule, not so much rely on the schedule of the hospital system. It's just a big machine that works, and you just cog in the wheel, so to speak.
So they always told you where you needed to be and what you needed to be doing before, and now you get to decide.
Yeah. So it's sort of, you don't have as much flexibility in terms of that. And I think also being small, you're much more agile. You can, hey, I need to get this instrument, and I can go and just purchase it myself instead of going through 5 different committees and to get one, little piece of instrument or something like that. So that those things were a little bit frustrating for me. And I think having that artistic background, I'm sort of, I want to have that a little bit of freedom and agility to do things that I like to do. I still want to be safe and have all the protocols in place to deliver the best possible patient care. But I think from the creative standpoint, I think that allowed me to have that flexibility.
Are there products or technologies that you're looking at now? You can make your own decisions and decide what you're going to bring in. There's no
I think
committees
this is
left.
this is the best piece of technology
Your
that was ever
hands.
invented right here. I think we're pretty low tech here. We don't specialize in high tech lasers, and I think our technology is always evolving in here and in here in our hands and our brains. It's we always look for the best new ways to deliver the best possible outcomes. But in terms of new injectables or fillers and things like that, we don't particularly dabble in that.
We should come up with a better word than low tech. I think what we'll call you is traditionalists or purists or,
Yeah, yeah.
yeah, I'll put my marketing hat on for that. What can patients expect when they come to see you for the first time?
Well, I think I really need to get to know the patient. I really want to know them and exactly find out what they're looking for, what kind of things they're looking to improve, and whether they have realistic expectations of what could be achieved. And there's multiple venues of how patients and providers meet each other. It's virtual or in person. That really doesn't matter. I think it's just a conversation. I think it's just kind of getting to know the provider and getting comfortable with them. I think that's really important. So,
How much time do you take for your consultations? Do you let people just stay all day?
we have an Airbnb in the
Go
office.
for coffee, come back?
Yeah, and I think that's one of the things you talked about is that also gives me flexibility here. Is I can spend as much time as I need with a patient, and I was really pressured in my previous practice to you have a 20-minute appointment. A patient comes in with a really complex issue and didn't really have that time to spend with the patient if they really needed it. And in a prior practice, I can spend an hour with them talking about their complex issue and really to get a time to examine them. And if they have additional questions, we can bring them back and talk some more. And there's not that pressure to produce.
So if somebody isn't sure or is like myself, I make decisions pretty slowly when they're important. Could someone come back and have a second consultation with you if they wanted to?
Absolutely, and I probably would say that I do that probably 20% of the time. People have follow-up questions, and we will have a follow-up either Zoom meeting or in-person consultation. My job is to make sure that the patient is comfortable. By the time they're set to have their procedure done, that they're very comfortable with that decision.
What does it tell you about a patient when they do ask for a second consult?
It means that they're really serious about it. It's not like getting a haircut. You really want to. When you're making a decision about having surgery, that's a serious choice. And patients are very informed nowadays. They do their homework and they may be a little bit nervous and they may have not asked all the questions. And I think it's important to make sure that they have ample opportunity to loop back and ask all questions.
I know a lot of facial plastic surgeons use systems like computer imaging to show people what their nose might look like after surgery. Is that something you do?
Yeah, absolutely. And that's another great tool that we have in our practice and really augmented my ability to visually show patients what their face may look like with this imaging software. Picture is worth 1,000 words, as they say. So if you can show somebody what things may look like, there's that kind of aha moment. I see what you're saying now, because you can explain to the patient in a million different ways, and they still may not understand little nuances. But once you show them a picture, it becomes clearer. So it's just a educational tool. It's not designed to say this is a guaranteed result. It's just a conversation starter to see what the patient wants, because we want to be on the same page. It's really important to establish that rapport and to make sure that what I can deliver is what they're looking for, and vice versa.
Then do you ever use your artistic skills to kind of speed that along? Do you draw on the images or do you draw on paper? How do you
I do,
incorporate?
yeah, I definitely do that, and I like to draw out images and diagrams of the patients, and we do that as well.
Will you send me a picture of the next drawing that you make?
You can go on my website, and I have some art on there as well. So you can
Oh, you
go
are
to
full of
westcoastface.com,
surprises. I will.
and
Yeah, what website is that?
westcoastface.com. And I think if you look in the tabs, there's an art gallery there.
Yeah, I'm going to link to this in the show notes so anyone who's listening can go look.
Cool.
Yeah. I would love to see a photo of you drawing a nose or drawing something for a patient, not with somebody's name on it, but just like an example of something that you drew to help somebody understand something. That would be fascinating. Make a great Instagram post. Okay, so what do you like to do outside of work?
I have 3 children, and they're ages 9, 11, 13. And I love hockey. I love sports. And so I had an opportunity to coach my youngest son last year in 8U hockey. So that was really fun. And so that's what we're doing outside of work for the past
Yeah,
year. Yeah.
that'll
So that
take up
was
some
really
time.
special. Yeah.
I grew up in Minnesota. I get the
Oh,
hockey
cool.
thing. Yeah. There's not a lot of hockey in Seattle either.
Well, it's growing. We have a professional hockey team here now, and so that really accelerated the growth of the sport. And we have some great facilities in Tacoma, and yeah, so it's really kind of blossoming here.
So are you like also the sponsor of the hockey team? They get hit in the face with a puck and you're right there ready to go.
No, no.
Yes, comes in handy though to have a facial plastic surgeon nearby.
Yeah.
What is there anything coming up, during the summer? I know the end of summer, the end of winter in Seattle doesn't happen until July 5th. So I know
Right.
that's a ways off still. It's a good April, May, June, 4 months away. Is there anything you're looking forward to later this year? Are you going on any trips or?
Well, we're starting to travel a little bit because the kids are a little bit older. So we're sort of graduated from the kind of lazy vacation, just kind of plump yourself on the resort and on the beach. And now we want to do more educational tours. So are actually planning a trip to Europe with the kids in Northern Europe, and can explore kind of the area of Normandy. And my oldest son is a big history buff, so he likes to learn about World War I and World War II, and so he wants to go to all the the beaches where the
Mm-hmm.
the D-Day happened,
Oh, yeah.
and kind of explore that area. And then we're going to travel further north and maybe see some castles in Germany.
That'll be a great adventure for all of you.
Yeah.
Yeah, that sounds wonderful. Okay, well, before we let you get back to your patients, I know you have one pretty soon here. We mentioned westcoastface.com. Is there anywhere else you'd like us to look to learn more about you?
Also, the seattlefacial.com has my information as well. And if you would like to learn more about what I do, those 2 websites have great before and after pictures. I also, my Instagram is Dr.Joe_Knows, KNOS. There's lots of before and after pictures and reveals. And I also have a TikTok account as well.
I will put both of those in the show notes. Those reveals are fantastic.
Thank you.
Yeah, they're so fun to look at and they never get old. So yeah, keep up the good work.
Thank you.
Thank you so much for telling us about yourself today, Dr. Shvidler.
Thanks. Have a great day.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.